morning. My name is Jenny Gaca, and I'm the mother of Amber Gaca, who is in the 4th grade. I'm here to tell you what it's like to be a registered nurse. I have been a registered nurse for about 20 years, and I've held many different positions in nursing. I used to take care of patients, which is the type of nurse that most of you are used to hearing about. I no longer work directly with patients. I am now working in an administrative role. I help manage other nurses and other healthcare organizations. That is one of the best things about being a nurse, is you have lots of different options on where to work and how to work and when to work. I currently help manage 21 surgery centers spread across 4 states. I am responsible for communicating with the nurses and helping them to do their job the best way that they can, helping them to accomplish their job while also keeping patients safe. I help them to follow all the rules and help them to manage situations that might be unusual for them. For example, I help manage critical situations. I help the nurses decide what is the best thing to do when things aren't always going the way that you want them to. I help prepare for disasters, such as when there's an earthquake, or now when we've got a major snowstorm. I'm one of the ones who are helping to make sure that they can still treat patients and keep everybody safe while doing what's right. One thing about working in healthcare is people never stop getting sick, so you always have to be prepared to deal with anything that comes to your door. One of the most rewarding parts of my job is providing leadership and guidance to those who need it. Every place that you work has a boss. There's always somebody that you can go to in order to help figure out a situation or to get more help. It's very rewarding for me to be able to talk to other nurses, to calm their fears, or to help answer a question when they're just not sure what to do. One of the other wonderful things about my job, as I mentioned, is the fact that I get to travel and work in many different places. Since being a nurse, I've been able to work and live in states like Michigan, California, Nevada, Utah, Alaska, and Tennessee. One of the most difficult parts of my job is to be prepared for a disaster. People who are working in my surgery centers look to me for guidance on what to do. If things aren't going the way that they think they should be, or if there's a big disaster that comes up, I'm the one who has to help provide them answers. I have to be prepared to give those answers at any time, any day. When I worked as an administrator in the hospital, there were many times I got phone calls at about 4 in the morning and had to wake up out of a dead sleep and go into the hospital because there was something going on that needed me personally to help provide guidance and organize the treatment. In order to become a registered nurse, you do need to have some level of college. That's another wonderful thing about being a registered nurse, is you can start off with a very low level of college and complete nursing school, and then there's other levels of college that you can complete later on. Before you can work as a nurse, you do have to be licensed in the state that you're working in, so you have to pass a test. Every nurse takes the same test regardless of how much college you had, and in order to be licensed, you have to have a passing exam on that test. Some different roles in nursing require additional education or certification, like what I do. I have a management and data certification, which is a little more complicated to explain, but it's an additional certification and an additional level of education to do what I am. But again, as I was saying, what's nice about it is I started off with a very low-level nursing degree, and then I went to work in other organizations, and they paid for my schooling in order for me to advance. So that is a huge perk of working as a nurse and in healthcare. Math and science are used as a daily basis when you're a nurse. When you're taking care of patients in the hospital, the nursing floor, you need math in order to calculate medication dosages. You need science in order to understand what's going on with the patient and to figure out what treatments are needed and what types of help you can give that patient. You also have to understand the science so that you can explain it to your patients. Even though I no longer take care of patients, I still use math on a daily basis and I use science every day. I have to communicate with nurses and other physicians, so I have to understand what is going on in their situation. And I can't understand that if I don't know the math and the science that they are using. Communication, collaboration, and critical thinking are essential components of being a nurse. As a nurse, whether working in administration like me or working with patients, you always have communication between patients, physicians, and other members of the hospital or healthcare team. You have to be able to communicate exactly what needs to happen or exactly what you want, or else the wrong treatment could be given to a patient. I've seen situations where doctors and nurses are talking to each other but not fully paying attention, and then a patient might get the wrong medication or get the wrong treatment. And this can be very, very damaging to a patient. So communication is extremely important. You also have to be able to critically think. When you're working with patients or in administration, things aren't always going exactly the way you want them to go. You have to be able to move with the circumstances and manage a situation. Every day I have to speak with nurses who are working in my surgery centers. They will give me situations and need advice on how to handle that situation. I have to critically think every day in order to figure out what is the best thing to do for the situation and how to make sure that that patient is kept safe. They rely on me to have the right answer when there's a disaster. If there is an earthquake or a snowstorm, nurses will contact me in order to figure out how to manage the disaster. And again, I have to use critical thinking skills and communication skills in order to get that message across to the nursing staff. Currently, with COVID-19, we have a lot of supplies that are short. There's a lot of the equipment that nurses use every day that aren't available to them. So part of my job is to help look at what equipment we have available to us and how we can make that equipment work with the patient and the nurse while keeping everybody safe. It takes creativity and critical thinking skills in order to work that out and to get that information over to the nursing staff so that they can perform their job function correctly. How does my job contribute to society? Well, a nurse taking care of a patient, it's obvious how they contribute to society. You have to have nurses in order to help the patients to get better. I know that I am no longer the type of nurse who's working at the bedside with the patient, but as an administrator, I have a key role in helping to make sure that those nurses get the resources they need and get the help that they need to handle a situation. The information that I help them communicate to other patients keeps people safe, and it helps make sure that patients can get the health care that they need at any time, including when there's a disaster. An example I had is last March when the COVID pandemic started. I was one of the people who were in the background. I wasn't treating the patients, but I was the one taking the calls and the referrals from the nurses and the doctors and helping them to understand what they needed to do in order to keep themselves safe, what treatments to provide to a patient, what is recommended by all this information that's floating around, how to interpret that, and how to use it to the best of their ability. So without somebody in my role, the nurses taking care of the patients wouldn't have the ability to go and look all of this up and answer all these questions. So they rely on me to help provide them with that guidance. So I hope this has helped you understand how you can be a registered nurse but working in a little bit different of a role, and how registered nurses do more than just take care of patients. They support themselves, they support other nurses, and they help take care of people in all kinds of different ways. So I hope you all have a good day, and thank you for listening to me.